Good to see some returning faces, and also I believe we've got some new participants joining us. So really happy that we're able to gather and spend the next hour or so together. So we have one of our hub team members, Dr. Evan Holloway, leading our didactic today, and then at about half of the hour, we'll switch up into the case-based learning. So as Evan is talking, be thinking about if you have a patient or a student that this topic feels relevant for that you'd like some group feedback on in a bit. But first, we will hear from Dr. Holloway, a UCSF Department of Psychiatry and Behavioral Sciences assistant professor and licensed clinical psychologist. Dr. Holloway is an attending psychologist in the Wavefront Outpatient Cognitive Behavioral Therapy Clinic at the Nancy Friend Pritzker Building on the Mission Bay campus. He has advanced training in pediatric and forensic psychology, substance use disorders treatment, including motivational interviewing and the family checkup model, and services research. Dr. Holloway provides clinical supervision through the Multicultural Clinical Training Program at the Zuckerberg San Francisco General Hospital and research supervision through the Clinical Psychology Training Program and Juvenile Justice Behavioral Health Lab. His research focuses on improving behavioral health and legal outcomes for youth and families involved in the legal and foster care systems and service access for publicly insured youth. So thank you all again, who's ever able to turn your cameras on and take it away, Evan. I understand that not everyone's able to turn their cameras on, but thank you to those who can.
Thanks so much, Lauren and Lindsay. Nice to see everybody here today. Today we're going to talk about identifying patterns of avoidance and opposite action plans to disrupt those patterns. So first disclosure, I want to give a huge thanks to Dr. Anna Swan and Dr. Allison Libby, who graciously gave me a tremendous amount of support for this presentation. And so I just want to definitely highlight them for their support. I don't have any relevant financial relationships with the commercial interest to disclose. CAP is supported by federal and state grant funding through HRSA and the California Department of Healthcare Services. Okay, so our objectives for today are to first name 2 signs of avoidance, identify one way that exposure can be an intervention for avoidance, describe 3 examples of opposite action, strategies for disrupting avoidance, and more if we have time, develop opposite action plans, and we hope that you'll be able to develop opposite action plans for common avoidance patterns among students that you serve. So I like to give this disclosure for all talks I give. Just want to say I'm here as sort of a messenger, have pulled together some materials from experts in the literature, but I also consider y'all to be the true experts here. So if you have anything to add, please, put it in the chat, unmute yourself. Hope this can be like a little bit of a conversation if you have something to add. So some facts about stress in school. Among kids and adolescents, school is the most common source of stress. So estimates show that about 60% of teens and 40% of children report time management of all of their activities to be a source of stress. So as I said, y'all are the experts here. And so I want to start by asking you, what do students avoid? And so you can, if you have a phone, feel free to snap the QR code. If you do not have a phone, you're on your computer, I'm going to change my share real quick to a Mentimeter. One sec. Here we go. Okay. Can you all see the word is it? Okay, great. So what do students avoid? Feel free to add it here so it'll populate as a word cloud. You also can, again, put it in the chat if that's more convenient, or unmute yourself and speak up. So what are some common things that you've heard about or that you see that students avoid? Yay, we got our responses. Lunch, okay. Speaking in class, schoolwork. Definitely, these sound common. Um, I'd love to hear more about lunch. Again, this is where I'm not working in a school, so I'm curious if whoever added that, if you'd like to add some context, I'd love to hear.
I sometimes hear students tell me that the unstructured time in lunch, if they're not feeling comfortable with their friends, can be really stressful and they might go to the bathroom or other places.
Okay. Okay, very cool. Thank you. Bullies, testing. Thank you, Sabrina. All right, awesome. Feel free to keep those coming. But
Evan, while we transition, sorry to interrupt you. I just want to say that I'm really happy we have everyone here, and I really appreciate everyone's commitment to being here, even if you're sort of in transit in between things. Everyone who's on the road, if we wouldn't mind turning your camera off, just so we don't worry about you and your safety or driving, we'd really appreciate it, and we love that everyone's here.
definitely safety first. Thank you, Lauren. All right. So we talked about some things that maybe happen you see in school, but I wanted to highlight one very sort of common thing that we'll see clinically or can be a presenting problem, which is school avoidance. And so this is more than just like typical school jitters. Everybody I think most people get some jitters. If you don't, then hats off to you. Even whenever I would be like teaching at university, right? And it's like the first day, I get like some of those symptoms of like my voice cracking, sweating. So even as a teacher, you might experience some of this. So when you're talking about school avoidance, the length of time that this might be happening and the function of why they're refusing are really important. This is different than like truancy, like a really, a long-standing, like not going to school at all. And it often can be a symptom of a deeper problem. School avoidance is most common, but not only, but most common among ages of around 5 or 6, 10 or 11, or in times of transition. And you might notice, right, what happens at around age 5 or 6 might be starting elementary school, right, or a new school setting, kindergarten maybe. 10 or 11, starting middle school. I still remember my first day of middle school, kind of a nightmare. And so I don't know that that's really changed for this generation. So some of the first steps in addressing school refusal are first to identify the function of the school refusal. Is it to avoid negative emotions, escape social evaluation, to get increased attention from loved ones, or other types of reinforcement? It's important to think too about what is anxiety provoking at the school and how we can address it. Similarly, when you start investigating a little bit more, it's important to think about what happens when the youth stays home. I spoke with a family recently where the kiddo's having a pretty serious like medical condition that's pretty distressing. And so they're staying home and they're playing video games all day, right? And so that's going to be more challenging, right, to kind of get this kid back to school. What to do about physical symptoms of feeling sick. And so trying to rule out, is this like a cold? I've got an upper respiratory thing going right now. That can be very common, right? Versus there also can be somatic presentations, right, of mental health disorders or other challenges. And finally, it's important to come up with a plan to support the youth's return to school. And that's what we're going to talk more about today. So I just want to reorient. Dr. Lindsay Brewitt gave a fantastic talk talking more about anxiety. I just want to reorient last month, but I just want to reorient to some important topics here. So first, fear is a response to imminent threat. And so we can have this fight or flight reaction, right, where we kind of will respond automatically in those moments, and kids included. Anxiety is more future oriented than fear. So an apprehensive uneasiness or nervousness, usually over an impending or anticipated ill. A lot of big words there. But anxiety serves a really important purpose. It prepares us for threats, helps keep us safe, to avoid danger, and to figure out when we need to get out of certain situations. So the goal here is not to get rid of all anxiety. It's adaptive, and research shows that they're like having too low anxiety, not great. Having too high anxiety, not great. But there is an optimal level of anxiety that's important for our functioning. So orienting to how anxiety works. These are all related, right? But I'm going to kind of start at the top with thoughts. So you might have a thought, or kids might have a thought about expecting something bad to happen. This can cause behavior of escaping that, like physically or mentally, right? And not wanting to think about things that are distressing. This can lead to physiological sensations of needing to fight, flight, or freeze. And this is sort of a vicious cycle, right? That then feeds back into thoughts of like, okay, something bad is going to happen again. So we're going to focus specifically on avoidance here today. So avoidance refers to behaviors that people use to avoid or disengage from specific situations or difficult feelings. And how does this work? So reinforcement is a mechanism by which certain behaviors can be strengthened. So positive reinforcement, right? You're providing rewards for a certain behavior that you want to increase. You can shape that behavior, or maybe in the example below in the cartoon, like your dog is shaping you to feed, to get fed whenever they sit. And there can be, you can provide rewards to increase certain behaviors. Negative reinforcement is when we're avoiding something stressful and then we get immediate relief. So I've been working on my taxes and I sit down and I start working on it and I'm like, all right, this is stressing me out. Did I get that 1098? Is it this 1098? Is that? Take a break, go play with my cat. I'm like, oh, I feel better. It's relieving, right, to walk away from my taxes. Negative reinforcement works by increasing the avoiding behavior and anxious thoughts or beliefs that are not tested, right? And so this cycle that we just reviewed continues. So it's really important to make sure that we're not rewarding avoidance. I gave the example of like staying home, playing video games is more fun, right, than going to school, especially if there's something anxiety provoking in the school setting. So how does exposure work? So many things can cause anxiety, right? But avoidance maintains that. So on the left, we have an anxious situation. We start to feel anxious. Then we might avoid that situation, right? Like my taxes. I feel better in the short term, but my taxes don't get done, right? And I didn't actually figure out what that 1098 is, and it's still waiting for me over there. And it is actually still waiting for me over there. And so I didn't figure out what to do yet. And so this is the cycle that others might be experiencing too right now on their taxes. Exposure therapy aims to disrupt that cycle. And with kids, it can take, supporting some bravery to help them slowly face their fears little by little. And just to reorient, exposures are the key ingredient in CBT for youth with clinical anxiety. Why exposure? So exposure helps to build mastery and confidence. So kids can actually experience the world differently, right? It can challenge those types of automatic thoughts and lead to different behaviors and different feelings. You can prove that those worry thoughts are wrong, right? Or not working very well, and to come up with new ones. It can be really helpful to get used to unfamiliar situations. And that's why, like, the first day of school, again, first day I'm teaching, I get some jitters, but then every class after that, it gets a little better and better. On the right, there's a nice graph kind of showing that there is a rapid increase in anxiety that can cause us to want to escape or avoid that. And one of the thoughts or beliefs we might have is that this anxiety is going to keep going up, right? But actually, over time, that anxiety lowers, right, as we are exposed more and more to that situation, and there's a reduction in fear. So as adults who are working with kids, it can be really hard to resist the urge to rescue, right? You see someone, a kid or an adult, right, in distress from that anxiety and wanting to like get them out of that situation. And so just want everybody to keep in mind, it's really important to resist that urge to rescue. So exposure one way we're going to focus on opposite action, but it's important to approach those situations. It sounds counterintuitive, but it's important to approach those situations rather than to avoid them. And so that can mean doing the opposite action. Now, with this increase in anxiety, and it's likely that you're going to see kids look more distressed, right? And so helping to support them and to do this gradually is important. One way you can do that is by using what's called an exposure ladder, exposure hierarchy, thinking about kind of situations that cause us the most anxiety, right? And putting those at the top, and then kind of ranking those as we go down to those situations that cause some anxiety, right? But less, and then rating those. And once we have identified kind of that hierarchy, we can start at the bottom and work our way up. Okay, so I'm gonna count on y'all for some participation again. So we're going to go through some examples of how opposite action can work. So you might be able to think of yourselves a time that you got angry, or kids that you've worked with, right? And anger is an emotion that gets us ready to attack, right? And it gets activated. It activates us to either kind of fight back or to defend ourselves. And so we'd love some folks to put maybe in the chat or unmute yourself, even better, to say, like, what do you think an opposite action might be? And I have an example. It doesn't mean it's the right example, but we'd love to hear from y'all. What might an opposite action be to anger? All right, I'm going to give you the answer to this one, and then as a little example. So the opposite might be to, we're feeling angry, to show kindness or concern for the situation, or to walk away, right, rather than fighting back. All right, let's try another one.
And Desiree added in the chat asking a question,
Oh.
maybe being curious.
Yes, thank you. I love that. Asking a question, kind of challenging, right? Like, what's really going on in this situation? Like, that might be causing me to feel anger, right? Or for kids that you work with. Thank you, Desiree. Shame. Okay, so shame gets us ready to hide, and it can activate us to isolate. What might be an opposite action whenever we see shame? Be around others, connect with others. Thank you, Nicole. That's great. Right. Oh, exactly. So, excuse me. So the opposite, right? You kind of to show some confidence, raise your head up, give eye contact, and shoulders back is kind of the example. But I love what you shared, Nicole, to be around others, connect with others, and that gives the opportunity to kind of question some of that, right? Why am I feeling so much shame? How are people really responding to me? Fear. Okay, so fear gets us ready to run or hide, and it activates us to escape danger. What might be an opposite action when we're presented with fear?
Maybe doing the scary thing, like I'm scared of snakes, so if I see a picture of one or I'm near one at the zoo, I try to make sure I look at it and don't run away from it.
Just sit with it for a bit.
Ideally not too close, but yes, I should.
Yeah. Right. If you were doing like a true exposure, right, you would. And then maybe think about touching it and getting closer, right? Absolutely. I love snakes, but I'm terrified of mice, right? So like it's the opposite for me. I have to like tolerate that. But living in New York for 6 years on the subway, I got much more accustomed to being around rats on the subway, for example, versus the first time. Okay, exactly. So what Lindsay said. So the opposite would be to go towards and to approach that fear, stay involved in it, and then build courage. Okay, Depression gets us ready to be inactive, and it can activate us to avoid contact with other people or with certain situations. What might be an opposite action working with a kid who's depressed? Activating activities. Exactly. Physical exercise, humor. Thank you, Nicole. Right. Do something. Get active. Perfect. Okay. Disgust. Disgust can get us ready to reject or distance ourselves from a certain situation, and it activates us to avoid. Thank you. I love that, Lauren. Fake it till you make it. Go even if you don't feel like it. Absolutely. I think it would work for a lot of these, but I think that was for depression. All right. So the opposite would be to push through and to get through that situation. Guilt. So guilt gets us ready to repair violations, and it can activate us to seek forgiveness. The opposite would be to sort of approach that, right? Guilt, apologize, and be genuine in our apology, right? I mean what we say.